that. Hook you up to this. All of the videos that I posted of our last one,
yeah, it did really good.
Something like
did really good.
And again, it just makes me like, I know a lot of this stuff.
Yeah, but a lot of people don't. A lot of people don't. That's the crazy part too.
It's crazy. Okay, what do you want me to do?
Okay, so are you comfortable laying on your back with the pillow behind you?
Yeah.
Okay.
I can do anything.
So go ahead and lay. Let me kind of check
show you what makes it hurt.
Yes. Yeah, show me.
So I can move.
Yep.
Fine. Everything is fine.
Yep.
This kind of hurts.
So leaning back, you're kind of like into an anterior post.
So like I'm like perfect right here.
Yep.
And everything is happy.
Yep.
When I anterior pelvic tilt.
Okay.
Oh, dude.
And is it like right?
Yeah.
Right smack in the
right
middle.
There.
Does it hurt here?
No.
Here? Or even like higher?
Mm-mm.
Okay. So it's smack in the middle,
right
literally right there.
Yep.
Okay. And then if you stand up.
Yeah, that's fine.
If you stand up and do an anterior pelvic tilt and posterior pelvic tilt, does it start hurting you? No. Okay. So it's mostly just with pressure.
It's all weight bearing. And it's like, then my toddler comes and sits on my lap at dinner, and I'm like, oh God, like,
just even more.
Oh.
Of the rotation that you can do, does that make it any better or worse? Without the anterior pelvic tilt and just like rotating?
When you directly support it, it's better. But with you pushing on the sides, it didn't change it. But if I tilt more, yeah, that hurts. But again, you supporting it makes it better.
Interesting.
And it feels like once I'm there, it's like okay, but it's the shifting
in and out,
forward and backwards out of it. Yeah, and I wonder even maybe a little bit side to side gets it, but it's definitely forward backwards is worse.
I'd say like the sacrum and the coccyx relationship is one of those like joints that most PTs fear. Even
of course we do. Dude, you guys.
Yeah. In many ways, right? Yeah. Like I feel like, I mean, that's why there is like the tradition, like the typical Great Lakes seminars that are.
That's what I took. I took that 2 years ago.
Oh my God, it was one of the like the best but worst course. I think I got out of there with like the worst migraine of my life.
I bet.
It's good, you need it, but you're like, and then what? And then what?
Yeah. Yeah, that was.
And then you're like, wait, it tips this way and it tilts that way, and then you do this and then you do that, and you're like, what?
And you want me to put my finger where?
Yeah, and then you're like, you want me to internally palpate to do what?
Yeah. Nope. Yeah, it was. So I took that pelvic floor course. Like I was 6 months pregnant with Annie, 7 months pregnant with Annie, and I was like, and I don't know how you feel about this. To me, like pregnant women have the ligamentous laxity where like, yeah, that stuff moves a bunch. I like mostly for me, most of our pelvis is pretty like fused.
Yeah.
And maybe a car accident gets it out of place to the point where like, we got to do something about this.
Yep. But like, even with the laxity, it hits obviously some people really hard where they become unstable, and for some people like it still doesn't do much.
Right.
And I think
everybody's different.
What do they say? The sacrum alone is only supposed to move a couple millimeters, right?
Right.
Like, so all the movements that it feels like you're getting, it's not true sacral movement.
Right, nutation and counter nutation and the whole thing. Yeah. Crazy stuff. It is. It's just it's interesting. And again, I was totally fine. I could deal with the pain and discomfort of it. But when I felt it like clunk and then it hurt, that's just what I told you.
Yep.
Like, okay. You busy?
So if you were to just like lean back right?
Yeah.
Because you're gonna have to lean back when you're giving labor, when you're giving birth.
Yeah, that hurts.
That hurts. Are you able to?
Yeah, it's uncomfortable.
Can you anterior pelvic tilt or posterior pelvic tilt to get off of that?
Anterior. Yeah.
Okay.
Okay. Once I'm here, I can settle into it and it's okay.
Okay. So if you get the epidural, you're going to have to remember this position.
Yeah.
Right? Because you're not going to feel it.
Right.
So you're going to have to remember that feeling.
Yeah.
And then are you able to bend your knees up as if you were getting into stirrups?
Yep. Oh, honey.
Yep. Good. Okay.
Yeah.
Are you able to anterior and posterior pelvic tilt that way?
Not well. My belly's also in the way.
Yes, it will be. Okay. Also remember,
it feels like it's parallel parked between two cars that you can't get an inch. Like that's what it feels like.
So you also have to remember that in the very beginning of the phases, you want to be internally rotated with your hip, so knees in, feet out. Right. In that position. Yep. Obviously, there's not much room on the table here.
I shouldn't have eaten before this.
Don't throw up.
Yeah. Right. Got it.
But in this position, it also kind of exposes the coccyx a little bit more, right? And so you really have to make sure that you kind of get that anterior and pelvic tilt rotated, like, that comfortable position.
Yeah.
Especially if you just get the epidural early, right? Yeah. Or things are just moving really quickly.
Yeah.
So I wanted to get you into this position so you remember what feels good, obviously even before going into labor, versus what does not feel good, in hopes that your body remembers, because the last thing you want is for you to go into labor, you get an epidural, you're not going to feel your coccyx or anything at that point.
Right.
So you're going to be in like a not so great position for a couple of hours potentially.
Right.
Okay.
And just pissing it off without realizing that
you're
pissing it off. Right.
And then postpartum, you're going to be like,
what the heck?
Yeah.
Yeah.
Okay. So let me get you laying on your back. Which pillow is this one? You want me to put it?
Yeah, we could throw the case on. Thank you.
So yeah, definitely keep working on that internal and external rotation of the hip. Yeah, that will really help kind of speed things up too.
Yeah. Okay.
Okay. Straighten out. Does it bother you? Does it hurt you or anything? You don't feel it? Okay.
Just go to my back.
Yeah. This traction's always the best.
Do you feel that?
Oh yeah. That was a good one.
That's a good one. That I've noticed happening more of, even if I've always been like pretty sensitive to, I'm able to crack my low back. But even like laying in bed with my daughter this morning, I'm just like, I rotate. Even in my class that I did, like it's happening more often.
Yeah.
So I know
the
relaxity happening. Yeah. The relaxant's turning on strong.
I was hoping mine would kick in.
Didn't?
Nope.
Oh.
I was still
now I'm thinking about it. I'm like, all right, good. It'll be breeze, right? Everything's loosey goosey.
It needs to be loose and relaxed. Good. So it's always good to just check your leg length. Pretty even here. If anything, this should feel really good. Pain with that?
No, it's okay. It feels good out here. If I'm wondering if I stabilize my back, just because I feel it on the left side a little bit. But once I hug my baby, it's better.
You're also right on the crack of the table. So I wonder.
It could be the one spot that I'm unsupported.
Yeah, exactly. Slide either up or down.
We'll go up a little bit.
I don't know which one would be better because you're pretty tall. You're still good. You still have a lot more space. Yep.
Okay. Let's go here.
Better?
Yeah, that's better.
Okay. Probably feel that a little bit. I shouldn't feel anything pinchy or anything like that, but
it's good. Yeah, nice to have someone else do it for me.
Isn't it? PTs.
It's like we're the worst patients, but it's nice to have someone else do it. Who knows what the hell they're doing? Like I could teach Nick all day long, but
nope, it's not the same.
It's not at all.
A lot of it is just feeling, right? And you don't know what you're even feeling for.
Yeah.
Not even all PTs know what they're feeling. But there's plenty of PTs who know so much, but like don't do a lot of manual work too, which is also really interesting. Because I feel like in most of what, especially with what I do, touching and like the handling plays such a big role.
I think I was still in school. It might have been afterwards. I heard somebody in our world say when you touch a patient, you talk to their brain.
Yep. Totally.
Like, that's such a good, like for better or for worse, or good, bad, or ugly, like how someone feels with you is important, and then how someone feels in your arms. Like,
yep.
I just remember I had a professor who, it was like our first or second practical, and all of us are scared to death, and we're holding the person's leg like way out here in front of us, and he's like, would you get in there and show it some love? Like, this poor person is terrified and afraid. Get in there and love on them. And I was like, oh. And then once we did it to each other, we're like, oh my God, it feels so much better.
It's always so intimidating when you're obviously doing a practical on people, like on them, on yourselves, and you don't really want to be too touchy-feely, obviously, but
and it's all pretend.
Yeah, it's like you don't really have that pain. You don't really have all of that, so it's different too.
Yeah. If I'm in like early labor, have Nick do this.
He totally can. Yeah.
For the internal rotation component.
Internal rotation will be really good. I'll show you a few moves that he can like assist with. And it also depends on like, with your first, how quickly do you go to the hospital?
I didn't know what the hell was happening. Like probably, I think I labored home for 2 hours and I was 4 centimeters when I got to the hospital.
Okay. Did your water break?
Not for Annie. Okay. Not until noon.
Okay.
Or 10 or something like that.
So typically what I tell people when they start feeling contractions, it's still a little irregular. It's strong enough to a point where you kind of have to like not talk. And you kind of like stop what you're doing mid-sentence. You're kind of like, okay. That's usually when like, a strong enough contraction is coming through. At that point, you actually want to start moving a little bit more.
Yeah.
You want to start doing things where, you can do like bent over, kind of like wagging your tail kind of movements. Deep low squat if your knees and everything else allows you to get to, which obviously you're all good.
Yeah, I'm good in that department.
If you have a ball like that at home, like a physio ball, you can do like pelvic tilting, circles, even bouncing to decrease some of the pain.
I went to the hospital with Annie before I had the epidural. I got a ball, and I sat on it for like, you know, in Harry Potter when they barely put the sorting hat on his head and they yell it, right? It was like that. Like, I sat on the ball. I was like, nope, where's the? I hate this.
Nope.
But I've seen like I'm going to use my ortho term, like a lat stretch on the ball, right? Of like just kind of hanging on all fours.
Yep. You can do that.
I'll bring one of those home today.
Child's pose.
Yeah.
Things like that where your feet are apart and your knees are apart. Anything like that would be really good. Anything to kind of get your hips to open, but also relax at the same time is going to be key. I also really like working on part adductor, part round ligament, which will be a little bit higher, part hip flexor.
Okay. Learning moment. Round ligament. What is it? What does it do?
These ligaments right here that basically just support your belly.
Okay. Different from inguinal?
Yes.
Okay.
Yeah. So inguinal is probably more, obviously, anatomically it's a little bit more different.
Right.
But think of round ligament as literally the ligament that kind of just
scoops under,
supports the belly here.
Okay.
Typically right above the hip bones here.
Right.
That just kind of come across this way.
Okay.
So that's why. So when people say like the round ligament, it typically kind of moves in this, like in like a circular motion and under the belly.
Yeah.
And then when people say like lightning crotch, that's actually right here on the pubic symphysis.
Okay.
Right where the pubis meets.
Right.
And that ligament right in between there starts to move, separate, kind of.
Oh,
again, it's not supposed to.
Right.
But when that moves about, that's when you're typically walking around moving, and then it just kind of shifts because of the relaxin. Right. That's when you get that jolting pain.
Yeah.
So that pain and like the achiness and the heaviness pain that you get under your belly are a little different.
Yeah.
You can get both. You can get one. You can get none.
Sure. Yeah.
But they're different areas.
Yeah. Yeah, I haven't had pubic symphysis pain, thank goodness. Have had, like if she moves the wrong way, like sciatic, like real quick.
Yeah.
Like, whoa.
Yeah. Okay. I'd say depending on how you move and depending on where the baby is positioning, you know, she could just.
That's exactly what it's been. Like just it's not often, it's not every time I move or whatever.
Yep.
And I'm lucky that I know what it is, because otherwise I'd freak.
Freak out. Yeah. And it's like soap, and you wonder why so many people at that like 8-9 month, you know, pregnancy time, they think they're actually in labor because they're in so much pain. Yeah. I've had a good amount of patients that were like, oh yeah, by the way, I went to the hospital last week, but they sent me home. And I was like, why'd you go? They're like, because my back was hurting so bad and everything was hurting so bad that I thought I was having contractions.
Oh.
And then they obviously were like, nope.
Wrong action.
They do an NST on you and they're like, nope, sorry, this is not contractions. Nope. So obviously the hip flexor is pretty hard to get to because the baby is kind of in the way.
Sitting there,
But doing a nice little myofascial all in this lower abdominal round ligament-ish area can really loosen everything up in a good way. Obviously, we're supporting the baby, we're supporting our bodies, so everything still gets tight, even with the relaxin in our body.
Yeah. And
although the pain that you're having is in your coccyx, because everything is together and everything supports each other, sometimes this tightness and the pain up in the front could just give you more pain in the back.
Affects everything in the back, yeah. I was just gonna ask you that, and like, I mean, it's all connected. Yeah. I always feel like when patients ask me that, I'm like, it's not a cop out of an answer because it's true.
It's better than it depends, right?
Yeah.
Because everything does depend.
But it's simple and it makes sense. If it's not, I've taken it to, it's like the ocean. Like you just can't separate it out.
What I'm hearing more and more now is people who have C-sections, obviously major abdominal surgeries, but people think that they recover well, which a lot of people do, right?
Yeah.
I'd say a decent amount of people recover well without having to need any services, without, any infections and everything going well. But 9 months to a year later, they get back pain.
Yeah.
And people like us will be like, oh yeah, it's because you had a C-section and everything is tight and scar is bound and everything is just not moving correctly. But they're like,
you've been running on adrenaline for 6 months.
Yeah. But then your baby could be potentially 20 pounds at that point, right. And you're carrying a 20-pound bowling ball all day, every day,
with no core stability and
zero strength, like you had before.
Yeah.
So of course, but little do they know, if you work on the scar and if you work on the right strengthening techniques, suddenly their back starts feeling better.
Wouldn't you believe it? Wouldn't you believe it? Yeah.
It's great. It's totally great because, people freak out that, oh no, like I messed my spine up. Oh no, is it the epidural? Was it what I did? Like,
Yeah, right. Everything hits at once.
Yeah, but it's actually not.
It's kind of nice when it makes sense. It like checks out that that's what happened. Of course it did.
Yep.
Yeah.
I feel the baby moving around.
She's a mover. It's wild. I remember after Annie was born, you're so used to like, and I'm pretty good. I'm not obsessive over the movements at all. Like, I know she's healthy. I know she's moving. Like, we're
You're not
good.
Counting every.
I'm not. I don't have my Excel spreadsheet out checking the boxes off. Which is fortunate, and also part of just me being me.
Yep.
But after I had Annie, I remember the next day being like, I don't feel the baby, and then be like, oh, that's because she's right there. She's not here anymore. And I just remember that being a weird adjustment of like, you go do whatever it is, 10 or 15 weeks of like, oh, just making sure like, okay, everybody's still there and kicking around. And then they're not.
It's like like phantom.
Yeah. Baby, yeah.
Right? Like you're
waiting for it.
Yeah.
Nope. Yeah, that was strange. I remember. And I remember like missing it.
Yeah. Because that happens for so many months. 6-7 months, right?
And that was, I felt like her and my like private way of communicating. Like I'd get worried about her, she'd kick, and I'd stop worrying about her.
Yep. Your right side's a little tighter than your left, but it's a little better.
So until somebody's doing something like this too, and you're like, I gotta get the foam roller out.
Oh yeah.
And I can't even say that. Mine's out. It's in the middle of the living room. I just don't use it.
Same. Again, our adductors really get neglected.
Yeah.
Right?
I always focus like IT band, quad.
Even from like the strengthening standpoint, your adductors just get neglected.
Yeah.
I mean, how many exercises honestly can you name that's like adductor forward, right?
3.
Copenhagen?
Yeah, right.
Ball squeeze?
Yeah.
Anything squeezing?
Plank with your foot elevated on the plank? Yeah.
There's really not a lot.
No.
And obviously during pregnancy, a lot is right in the middle.
Straight, yeah.
We know that our base of support changes from forward to back, but it also changes up to down, right? So our adductors just gets really tight. And then if it's too tight, if you think about it, if you try to get into like that laboring position, and if you're too tight, it's not going to get to that position that you want to. Therefore, you're not going to have the proper opening. Therefore, you have to either push harder, longer, and wait longer for the baby to come out.
Yeah.
Positioning makes a really big difference in how, you don't have to be super flexible, like, super loosey-goosey and a gymnast.
Yeah.
Doesn't mean that, people like, is Simone Biles, is she going to be able to just push a baby out and pop a baby out just because she has all that flexibility?
Yeah.
No, not necessarily.
Right. Well, and like, as you're talking and I'm thinking about like all the things that I do for my patients that are like ounce of prevention. Ounce of prevention is worth a ton of treatment. And like, you must, at least if I could conclude, you tell me if I'm right or wrong, like, you must roll your eyes and think like, don't let your adductors be the reason you can't get into a position. Like, that's such a silly low hanging fruit. Of like, let it be let it be your blood pressure for all I care, but don't let it be your adductors.
Yeah. Too often it is, right?
And like, or like, don't let it be your hip internal rotation, because like, you really low hanging fruit to intervene on that. And makes a huge difference. Yeah. And like what we just did in the very beginning, when you said like, I want you to get into this position and feel it, like, that's an ounce of prevention, because don't let the position that you're in for 5 hours during labor piss your coccyx off for the next 6 months.
Yes.
Don't do that. Like,
nope.
Here, learn it now. And feel what it feels like.
Yes.
And then remember it.
Because again, I think, most people have the epidural, and the feeling, obviously that's what it's meant to do, right? The feeling, the sensation, that's gone. So if you're, you hear of stories of people pushing for 2-3 hours, you're in that position. Can you be in that position normally?
Right.
Without
and straining like you are? Yeah.
No, it's not.
And not without paying for it the next day.
You're sore.
Or the next 10 days.
Without a baby coming out.
Yeah. Right.
So imagine everything else.
Yeah.
And I get that it's an optimal position for the healthcare system that we live in.
Totally. Yeah.
Right. But it's not the best for us.
Yeah, for mama. Yeah. Yeah, I mean, I think I told you when I was on my back and pushing it just felt so unnatural. And the way they taught, well, all right. How do I breathe?
Breathing?
Yeah.
So they will tell you.
Yeah, it was awful.
To hold your breath and bear down and push.
I freaking hated every second of it. I thought I was going to pass out. I looked around. I was like, how do people not pass out?
Probably, a lot of people do. That's why they feel nauseous. That's why they get sick. It's
awful. So how do I?
So pushing is always, although you do need a push, right? Although it's a downward pushing motion, I always teach it, and a lot of doulas, midwives will teach it as breathing out. You can almost hum, which will also, regulate your nervous system. But what you want to be doing is you want to be exhaling while you're pushing. So not hold your breath, bear down and push,
right? But
more like a literally exhaling out the push.
Okay.
If that makes sense. I think back, I think sometimes depending on who you talk to, it's, sometimes called pushing, purple pushing, right? Because your face gets bright red.
Yeah.
If you're pushing like that, yes, you will get red and purple.
Yeah.
But you don't want to be.
Yeah.
You want to still kind of talk through it in a sense that you're kind of breathing through it.
Yeah.
You might not want to use this for the video later, but
go ahead.
See. When you are pooping, right?
Dude, I practiced. Yeah.
If you are pooping and you just push and push and push and hold, and then like you kind of take a breath, your poop sometimes comes back up.
Yeah.
Because our bodies is a vacuum system, right?
Yeah.
But if you push and breathe, at that point, you can take another breath without feeling like you lost the breath.
Yeah,
and then progress. You progress, you hold it, and then you breathe again, exhale, and push it out because now you caught your breath.
Yeah.
You can usually let that poop out.
Yeah.
Without it kind of going up and down and up and down.
And irritating everything down there.
Yep.
Yeah.
So that's very similar to how a baby is.
It's actually been really helpful because I'll tell you this, like whatever for the video, of like I've had real bad hemorrhoids, real bad, and it's like I will take every freaking step I can to not. I'll probably get them when I deliver a baby, but if I poop like a gargoyle. Right. I don't squatty potty. My feet are on the freaking seat. And I have practiced. Like and like I get the self-talk in that way, and I'm like, your body will do it. You just gotta let it. Your body will do it. You just gotta let it. That's like it's helpful. I also I watched a video of somebody talking about like you almost want to like. It was a helpful image of like breathe in a circle, right? Of like in through here and then out, out through there. Like what you just did reminded me of that.
Yeah, no, that's a really good one too. Because it has to be continuous. You do
it has to be.
It has to be, right? Like it's not like there's a stop and go. And yes, sometimes does your, birth, labor, does it stall? Yeah, sometimes it does. That's sometimes your body's your body, right? But I feel like when you're actually in that pushing phase, that reflex that you get, which is like the urge to push, it's gonna come, and when it comes, that's when you go.
And then you go,
It's literally like when you have to go to the bathroom.
Like when you poop. I was just thinking
when you have to go to the bathroom, typically you have to go. You have to fight real hard for yourself to not go when you gotta go. When it's really time to go.
Yeah.
You feel that pressure.
Yeah.
You feel something coming out. That's exactly how the baby comes too.
Yeah.
It's it's definitely when it's time to go, it's time to go.
It's time to go, yeah. Yeah.
I'm going to get you on your side too.
Sure.
Which side are you comfortable on?
Whether.
Face that way.
Good night.
Right?
Dude. I gotta say, I threw in the towel and I'm sleeping with my daughter.
Yep.
And it's so much better.
Yeah.
Like I'm not stressing about. I've just like come to accept it.
Yep. And she probably sleeps better.
Oh, we both sleep great.
Yep. So ultimately, if you guys both sleep well, then
it's solid.
It's fine.
It's fine. It's not a forever thing.
Exactly. That's what my mom said. My mom's like, there's gonna be a day where the kids aren't gonna want to sleep with you. And I'm like, I don't know about that.
Yeah,
but
quite.
I'll keep thinking about
that. Yeah. Yeah, we'll see what happens, but it's been just so much better. Mm-hmm. And like I'm better for it.
Yep.
So
again, physical touch, right?
So, yeah. Oh yeah.
They feel better. They feel more relaxed. They're more calm.
Yeah.
And it is amazing that some kids don't need that either. And some adults that don't either, right?
Yeah. Yeah.
I know plenty of babies where, you know, their moms are like, oh, well, if I try to hold them and sleep, like they don't sleep. I have to put them down.
Yeah, and that's like, yeah.
And that's fine too.
Some of us are just kind of like that.
All this should just feel like subtle movements.
Yeah, it's all fine.
Nothing painful. So I would say, although you're obviously getting into that prepping mode, still continue working on your glutes, right? Even if it's simple clamshells, simple bridges, even if it's just like walking backwards, right?
Yeah.
Like anything to activate the posterior side of your body is still going to be very important. And I say that because a lot of times the backside of our bodies, it just gets neglected, right? We always walk forward. We always do things on the like going forward.
Yeah.
But the backside always gets neglected.
Yeah.
And sometimes coccyx pain and tailbone pain, you know, all of that can also come about when your glutes just literally atrophy.
Yeah.
Right. I mean, I don't know of too many people who could just like roll onto their sacrum and say that it's 100% comfortable, unless that's like what you do.
Yeah.
But a lot of times when your glutes get weaker and you just don't use it, they shrink. So if it shrinks, you have no cushion.
Right. So it's padding. Yeah.
Yep. Yeah. So kind of still, you know, you're doing all your sit to stands up and down, all of that, which is great.
Yeah.
But I'd say once in a while, you know, doing some bird dog